What's going on, everyone? Episode 2, dose 2. It's not 222, just it's episode 2 of the Ryan Balmez podcast. Let's get right to it. In this episode, I wanted to talk about the answer. This is something I see a lot when I take on physical therapy students or when I meet new grads, is that sometimes you all mean well and you're looking for an answer. You're looking for the silver bullet. And I want to forewarn you that there is no silver bullet with practice. If you're trying to look or get out of me in terms of do this technique to get this better, just understand that I just cringe even giving out such advice because it just is never that clear cut for a variety of reasons. But here's the first one. Tissues take time to change. There is very likely no manual therapy intervention or exercise that gets tissues to change so quickly. And you even have to ask yourself, is tissue change what you really need to get to where you want to go? It's a loaded concept, but the concept is, even if you get that extra mobility or stretch, well, so what? What does that matter? What does that even mean in the overall functional realm of what that patient needs? So when you're looking for answers, or if you're stuck in terms of with a patient, like, what do? I will actually point you in the direction of understanding, at the very least, that there are answers out there to help guide you with your clinical reasoning and best practice. When I say best practice, it is a term that's thrown out frequently, but the way to understand what best practice means is that in the worst case scenario, if you are sent to the court of law for whatever reason for your practice and you were grilled by your own colleagues and a jury, they would want to know, were you practicing at the best practice of your profession? And that's a responsibility that all of us bear, right? They don't care if you're not an APTA member. They don't care if you don't read JOSPT. If you were in the court of law for negligence or doing something wrong, they will judge you to the highest level of what your profession is expecting you to be. And that's APTA membership, and that's following along best practice guidelines. It is what it is. You can't escape it, whether you're an APTA member or not, whether you like it or not. That is what would happen in the court of law. Those documents serve as a guiding document of what you shall do or should do in clinic. And so where you could find those clinical best practices are actually pretty easy. JOSPT, the Journal of Orthopedic Sports Physical Therapy. God, I love that journal. That's available. And in there are clinical practice guidelines from JOSPT, where it breaks down, I guess, pretty much by body parts: cervical, lumbar, patellar tendinopathy. It breaks down certain elements of our orthopedic practice, and it gives you the laydown of everything you'd want to know and everything that you should be doing for practice. Will it give you, like, you should do 3 sets of 15 for this? Not likely, but it will give you guidelines in terms of these are some guidelines you can do for a patellar femoral pain syndrome patient. The answers are right there, and they are actually free on JOSPT, if I'm not mistaken. And if you're wondering where that comes from, JOSPT, the journal, seeks out respected authors and experts, mainly those with PhDs or even clinicians, and then they scour all the evidence for you, and then they scale it down to the best practices that they have seen from their evidence, and they'll even tell you if one suggested guideline is more expert opinion or this is really, really good research and studies behind it. So that is a quick and dirty way, and I'll leave it in the show notes and under in the YouTube channel description where you could go. JOSPT clinical practice guidelines, start from there. The second one is the ortho section. So the orthopedic section of APTA has a great resource called Current Concepts. Now, during residency program, this was my Bible. It still is. I'm still in the old version. I haven't bought the new version. But Current Concepts is, think of the clinical practice guidelines expanded by 1,000. So let's say when you download and buy the Current Concepts for lumbar, it is a hefty PDF document, or even when you print it out. It will go down to the nitty gritty. It will explain treatment concept. It will explain diagnosis, prognosis, everything you would want to know about a body part and region. Current Concepts will do that for you. Now, it's not free, but may I suggest it is probably the best investment you could do if you were a new grad or anyone really willing to get into orthopedic physical therapy seriously. I'm talking seriously, not like, I want to get better Monday. No, you want to get better for the next 10 years. Do yourself a favor and get that right today. I'm not getting paid promoting this. I am doing this for the sake of you, the listener and watcher. If you want to get better and helping your patients, read that, buy that, and you will find yourself, in terms of your clinical reasoning and practice, improve. Now, some strategies in terms of how to pay for it. So it's not cheap. It's about several $100s. But if you are working in a bigger corporation or company, make sure to use your Con Ed money wisely and buy that. And let's say that you're only allowed to use your Con Ed money for internal courses, which is really weird, by the way. Just find a way to finagle it somehow. It's pretty easy, I think. Not easy, but if you're determined to make the changes in your budget, a few $400, $500 could really set you a long way for having you feel more knowledgeable, confident, and enjoying your clinical practice. So for me, I think that's a small price to pay. Some other resources that I love to see or even read, the British Journal of Sports Medicine has a lot of free resources online, but really good journals there too. And then ultimately, it's not Google, PubMed. PubMed is it's where I go. It's where I go to if I have a clinical question, I search that. But that gets to more like nitty-gritty clinical questions. If you want broad strokes, best practices of where to find the answers for certain treatments and certain regions, Clinical Practice Guidelines and the Current Concepts are going to be your best bet. Now, when you're getting that, I want to add one little extra piece of advice. When you buy that, or when you get all those clinical practice guidelines from JOSPT and the Current Concepts from Ortho section, make yourself a learning plan. You are a professional now. There will be no one here holding your hand saying, hey, you should read this now. Hey, you should read this now. And so from a almost self-improvement standpoint, or even like a training, like a physical training standpoint, you have to create a plan. My suggestion, if you're in no rush, give yourself one portion of the clinical or the Current Concepts, one portion a month. It's a little bit slow. I'm pretty sure there's more than five of them. But if you commit one per month, it'll get you going. And you could prioritize. If you see a lot of lumbar, go ahead and read that lumbar Current Concepts now. Give yourself a month to learn it, digest it, question it, highlight it, do all that stuff. Clinical Practice Guidelines, you could do the same thing. They're a lot smaller. They should be a little bit faster to read. They're not as dense as the Current Concepts. Clinical Practice Guidelines, may I recommend you commit yourself to reading one every 2 weeks. And then you go from there. If you want to even level up your self-reading and self-improvement with these readings, find a colleague and partner that you could study with, where you could discuss with. It doesn't really necessarily matter with who, but someone that you know has that same energy and passion to want to get better. I think if you have a partner in doing so, that'd be really great. If you want to make a group out of it, very cool. And if you happen to have an older colleague who has gone through similar training, who could give you more insight or soundboarding, maybe ask them if they'd be willing to discuss things with you as well. You never know unless you ask. So those are my pieces of resources that I would advise anyone. If you're looking for the answer, they're out there. And really, it's ultimately up to you to really take the onus on you to go ahead and make that self-improvement for your clinical practice. Because again, ultimately, when you get better, our patients get better, and society as a whole lives healthier and moves awesome. So awesome. That is episode 2. I'm Ryan Balmes. Thank you for listening to Ryan Balmes podcast. If you haven't done so already, subscribe to the YouTube channel. Give it a thumbs up. Comment below if you have any questions. Thank you to podcast listeners. Subscribe. Go ahead and give us a rating. And again, share with 3 colleagues, with someone that you think would be would really enjoy this podcast and really find it helpful, this advice. Talk to you guys soon on the next one. Peace.